me a little bit about why you would recommend bio oil to a patient.
Bio oil, it's a brand that I've used for years. My whole family's used it. I've recommended it to patients for several reasons. I have a background in emergency medicine. So in the trauma unit, we used to often see patients with various cuts and other open wounds. And as they were healing, they would always ask me, you know, what do I recommend to help to reduce the scars, especially the moms. They obviously didn't want their little ones to have really bad scars as they get older. And so bio oil was always one of those products that was, you know, the first one that came to mind. And yeah, so I find it very effective. I myself have used it for several years. And I love the fact that it's also undergone clinical trials. I don't know if you know, but I used to work in research as well. So, you know, evidence-based medicine is important, that we recommend products that are based on sound science. And so, yeah, bio oil is one of those brands. So
it comes as Dr. Carmen recommended.
Yes, it definitely does.
Amazing. So you mentioned a little bit about, you know, you've used it yourself. Tell us a little bit about that origin story.
Yeah, so it's a brand I've known since I was a little girl. My granny used to use it, and I've used it on various cuts over the years. And when I was pregnant, I actually used it on my belly, and I have no stretch marks. But actually, when I was pregnant, like 8 years ago now, but there were quite a few new brands that came out on the market for stretch marks, and bio oil was just one of those that I've always stuck with, and yeah, it worked for me. And I've actually recommended it to friends, other patients for their pregnancies. So yeah.
So which products would you say your patients have gravitated to recently?
Yes, so I think there's been a big shift towards more natural products, and my pregnant patients prefer the natural bio oil. Okay. It's got no additives, it's all natural, it's got no extra fragrances added to it, so I think that works a lot more now with pregnant women. Another product I actually really love is the body lotion. I don't know if you've tried it, but the body lotion's got oil and you activate it by shaking it. So I actually recommend that for my older patients. So as you age, you lose some, you know, collagen in your skin, and it becomes very thin, especially in your lower legs. And a lot of my elderly ladies, they tend to sort of scrape their skin on the corners of doors, cupboards, and things like that. And the skin actually, if it's really dry, it actually comes off. So I find if they moisturize with that oil, it just adds that extra oil to the epidermis to keep it nice and supple, so that to avoid those kind of accidents.
Amazing. And what is the feedback that you're getting from patients, both on the natural oil as well as the lotion?
Yeah, no, they love it. They love the texture and the way it makes them feel and how it absorbs into the skin. I get really positive feedback.